Hi, Ivy.
Hi.
My name is Dr. Mad. I'm going to do your exam today. Thanks for coming in. What's going on?
So I had this thing. It had never happened before. I think I fainted. It was a couple of days ago.
Okay.
But afterwards, I didn't have any symptoms. I did feel like a little bit dizzy when I fainted. And luckily, I was sitting down. So I didn't fall too hard. I did fall to the floor, but not too hard.
Did you hit your head?
No, I didn't. Well, maybe I did, but it doesn't hurt. There
So
was carpet.
you don't remember?
So, yeah, I don't remember.
Any bruising that you noticed?
No, I didn't really notice.
Okay.
And I don't really have any pain.
Is this the first time that's been happening to you?
Yeah.
Okay. Do you remember if you had breakfast that day? I'm just trying to figure out.
I don't usually have breakfast, so probably not.
You did not? And what time of the day it was?
It was around noon.
Okay. Any new stress in your life?
Not really.
Okay. Did you change jobs recently?
No. I did change. I'm trying a new workout program, so I don't know. I've been focused on that.
Okay. So you increased your workout regime and you are continuing to eat the same as you were eating before workouts?
I am in a calorie deficit right now.
Okay.
So it's been like 2 weeks, 2.5 weeks.
Okay. Are you taking any medications on a daily basis?
No.
No meds. Are you taking vitamins?
No.
Okay. Any surgeries in the last 2 to 3 years? Okay. Okay. So we have a few options. We're going to test you for orthostatic hypotension to see if there is a drop or an elevation in your systolic blood pressure, and we're going to watch your heart rate as well.
Okay.
Sometimes that can be a circulation problem caused by some constriction of nerves. So we're going to check your cranial nerves as well.
Okay.
All right, I'm going to have you change into a gown, and I'll be back to check on you.
Okay, thank you.
You're welcome. Okay, I'm going to go ahead and take your blood pressure. Okay, so we're looking for a change or a drop in blood pressure. That could definitely be causing some of your symptoms. Okay. And now I'm going to leave that in. Okay. And I'm going to have you lay down with the head over there, and I'm going to retake your blood pressure. Okay. Okay, I'm going to have you extend your arm. Just a slight drop in blood pressure. So far it looks negative for orthostatic hypotension. So now I'm going to have you stand up next to the table. All right, how are you feeling? Any dizziness?
No.
Okay, that's That's good. Let me know if you feel faint at any moment while we're doing this, or if you have any darkening of your vision, you feel sweaty. Okay?
Okay.
Okay. Very good. Let's go ahead and take this off of you, and I'm going to have you sit back on the table.
Okay.
All right. Very good. Let's go ahead and put this on as well. Okay. Lying down, blood pressure spiked a little bit. It was 115/70, and standing up actually it dropped. It was 108/63. Heart rate 77. Oxygenation 95% on room air. So I would say overall there's no indication that you have orthostatic hypertension. Sometimes when people experience that, they could have some dizziness and some associated symptoms that you also experienced.
Okay.
All right, I'm gonna go ahead and do another checkup. Okay, have you experienced any loss of smell?
No, I do notice sometimes right before I get migraines sometimes, and right before I smell smoke.
Okay. And before fainting, do you have any abnormal smell?
Not the smell, no.
Okay. Can you please look up for me? I'm going to take a look inside your nostrils. We're looking at your adenoids. Go ahead and keep on looking up for me. They are a little bit enlarged. Do you snore at night?
No.
Okay. Since you're describing that loss of smell, I'm going to check your olfactory nerve as well. I'm going to have you cover one nostril. Can you breathe in, breathe out? Okay, so it doesn't seem to have any problems. Yeah. Okay, good. Go ahead and tell me what this smells like. It might be very strong.
Yeah, it kind of smells like garlic.
Okay.
No, that's definitely garlic.
Okay.
I'm not really sure what the other one might have been, like onion or
Okay.
something similar. It smells like a fruit.
Okay. So all three were wrong. I believe you did mix them up a little bit. You were close to the garlic and the onion. Okay, so it was raspberry, the last one that you smelled. Okay. Is it okay if I take a look inside your mouth? Yeah. Okay. We're looking for any deviation of the tongue to the left or right, anything swollen. I'm gonna have you give me a big ah. Okay, uvula is midline, so that's good. I'm going to put the blade inside your mouth on one side, and I'm gonna have you push with your tongue the blade, okay? Okay. Good. All right, can you please give me a big smile? Okay, and now frown. puff your cheeks for me, please. Don't let me unpuff them. Okay, good. So I have here a few samples. They have different tastes, and I'm gonna have you identify them. But for this, we're going to place the paper on different parts of your tongue. I want to make sure that the parts that are supposed to detect a certain type of taste function properly. Okay, so this one is going to go on the right upper side of your tongue.
Tastes maybe a tiny bit better, but barely.
Okay. Okay, now this one is going to go on the left upper part of your tongue.
Yeah, like better.
Better. And this one is going to go on the front part, so on the tip of your tongue.
It's like salty. Okay. Bitter, salty.
Have you noticed when you eat certain foods that they don't taste the way you remember them?
Yeah.
Okay. And this one is going to go in the back, closer to your throat, okay?
Okay. I cannot taste anything.
Okay. Okay, I'm gonna go ahead and take your temperature. This is going to go inside your ear. I'm just going to pull a little bit upwards. Okay. It is a little bit low. Let's go ahead and write that in. .1. Do you feel shaky at all right now, or?
No, I do think I'm starting to smell smoke actually.
Okay.
So a little bit like dizzy maybe.
Okay, let me know if it gets worse, okay? All right, I'm gonna have you look straight at my nose. So you're wearing contacts, correct? Okay. Keep on looking straight. I'm going to flash a light in your eyes. Okay, I'm going to lower your lid a little bit. I'm looking for any yellowish discoloration, any kind of increased redness. Okay, can you please look right here for me? Okay, no rhythmic changes. Now look here. Okay, good. Go ahead and close your eyes. Okay, that was kind of fast. Let's go ahead and try that again.
Okay.
So don't let me open your eyes, okay?
Okay.
All right, now go ahead and lift your eyebrows up. I'm gonna try to push them down. Don't let me do that, okay? All right, that's definitely not expected.
Should I be concerned?
It's not normal to have that flaccid movement and flaccid muscles in the upper side of your face.
Okay.
But let's keep going and see how this goes. So far, I did see a decrease in nerve 8 function. I'm gonna have you cover your left eye. Can you hold this Allen chart for me? Extend your arm all the way. Okay, can you tell me what color you see here?
Red.
Okay, what about here?
Green.
Okay. Can you read this row starting with the first letter to the right?
I'm sorry, I just see like kind of like a blue light in the middle of the Snellen chart. Is there a light?
No, just do you see this letter right here, for example?
Yeah, S.
Okay. Do you see this one?
O.
Okay. Do you see this one?
Yeah, H.
Okay. So keep reading after
Oh.
H.
Well, that was J. I thought you were pointing to the one below.
Okay.
It's J, H, D, F, C.
Okay. So that's definitely not wrong.
Okay.
I'm gonna have you switch eyes.
Okay.
Okay. Go ahead and tell me what color you see here.
Blue.
What about here?
Red.
Okay. What number do you see here?
6.
And here?
7.
And which circle is smaller, 6 or 7?
6.
Okay. Let's go ahead and just try one more test. So I'm gonna put my fingers in your field of vision and then I'm going to take them out. Let me know when you don't see them anymore, okay?
Okay. I still see them.
Okay.
No.
Okay.
I still see them.
Okay. All right. I'm gonna have you lay down and I'm going to take a look at your face and your scalp.
Okay.
I'm going to go ahead and palpate your sinuses. So we're starting with the ones on top of your eyebrows. Feel feeling for any kind of swelling. And let me know if you feel pain as I'm doing this.
Okay.
Okay, checking lymph nodes. Checking trachea. Okay, does feel midline. Can you go ahead and swallow for me? Okay. One more time. Okay. Any difficulty doing that?
Yeah, it felt really hard the second time.
Okay. I'm not feeling any lymph node enlargement. Okay, I'm going to do a sensation test. Can you please tell me on which part of your face you feel this, left or right?
Right. Right. Right.
to be a loss of sensation on the left side of your face. Let's go ahead and try one more. Can you please tell me if this feels sharp or dull?
Sharp. 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 I felt that though.
Okay, so you can feel it, but you can't distinguish the sensation, correct?
I think so.
Okay. Go ahead and tell me if it feels sharp or dull.
Dull. Sharp. Dull. 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 Sharp. 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 Sharp.
Okay. Go ahead and tell me when you don't feel the vibration anymore.
No. No. I don't feel any vibration. I didn't feel a vibration.
Do you feel this?
Yeah, I mostly hear it.
Okay. What about on the left side?
Same thing, I only hear it.
Okay, so vibrations on both sides are off. I'm going to try now with something a little bit sharper. It has some pointy parts, but it's definitely not going to penetrate the skin. Go ahead and tell me if this feels sharp.
No. No. No.
Okay, go ahead and tell me if this feels sharp or dull.
Dull. Dull. Dull. Dull. Dull. Dull. Dull. Dull. Dull. Dull. Sharp. Dull. 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 Dull.
And does this feel cold or warm?
Cold. Cold.
Okay, so that's good news that you can sense the temperature.
Cold.
Okay,
Cold.
so everything is cold.
Cold.
Okay.
Cold. 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 Really cold. Cold. Cold.
Okay, I'm gonna go ahead and take a look at your scalp now. Okay, mainly I'm gonna be focusing on the top part of your scalp. I'm not seeing any kind of redness. Go ahead and tell me if you feel 2 or 1 pressure points.
I barely feel that. I think that was 1.
Okay. So just do your best.
1. 1. 1.
And does this feel cold or warm?
Warm. Warm. Warm.
And does that feel warm equally on 3 sides?
I think it was warmer towards the forehead.
Okay. What about now?
Yeah, same thing, warmer towards the forehead.
Okay. Does this feel sharp or dull?
I did not feel anything.
What about now? Does this feel sharp or dull?
Dull.
What about now? Sharp or dull?
Dull.
No.
Dull.
Okay. Do you feel 2 or 1?
1. 1.
Okay. Does this feel sharp or dull?
Dull.
And now?
Dull. 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 Dull.
And does this feel sharp or dull?
Sharp.
Okay, that's good. And now?
Dull.
Okay. We're going backwards. Does this feel sharp or dull?
Dull.
Okay. And do you feel this as 2 or 1 pressure points?
1. 1. 1.
And can you feel this? What about down?
Yeah.
Okay. Does this feel dull all the way?
Yeah.
Okay. I'm gonna go ahead and examine your back as well. So I want to take a look at your spine. Is that okay?
Okay.
I'm gonna go ahead and palpate your spine. We're looking for any abnormal sounds as I'm pressing down the skin. Also, any swelling along the paraspinal muscles. That could indicate a constriction of the nerve vessels moving in and out from the vertebrae. Okay, you could be having a facial constriction of the vagal nerve, and that definitely can cause syncope and fainting. take a deep breath in for me. And exhale. Good. Again, take a deep breath in. And exhale. Good. And again, breathe in. And exhale. Good. Breathe in. And exhale. I didn't hear any crackles or wheezing. I need to check for any elevations from the skin. We're also looking at skin perfusion. To draw some letters on your back. Can you please tell me what letter I'm drawing?
Maybe like a P or an R. Oh. P. D. Slowly one. A.
Okay, and what shape am I drawing now?
C. This is like a mountain.
Okay. Okay, go ahead and tell me if you feel any kind of pain. Looking for any neurological responses. Good. Go ahead and tell me if you feel this on the left or right.
Good. Middle. Does this feel cold or warm? Cold. Cold. Cold.
Go ahead and tell me when you don't feel the vibration anymore. Do you feel the vibration? Okay. Tell me when it stopped. Let's do that one more time.
No.
No. No. Okay, there was a delay there. I'm gonna have you sit up and we're going to talk about our next steps.